that you actually make a change in people's lives, right? A positive change for the most part.
The opportunity to help patients when they're at a time that's very scary for them, very emotional, and they have a lot of needs, and it's an opportunity to make a difference in someone's life.
The instant gratification of being able to help people, you know, fix an acute problem, take them to surgery and fix whatever's going on, and then the next day they feel better and they thank you for it.
I tell them it's not easy to be sick. There's no good time to be sick. That they should be open and honest with us about what's bothering them, what's troubling them, that we will do our very best every hour of every day to make sure that they experience an excellent operation and an excellent outcome and an excellent experience all the way along the line.
I would say with our expertise and our practice, all of us have seen the worst of the different surgical problems, and for the most part, we can take care of complex issues.
I'm very careful about making sure that they understand that their attitude towards their surgeon and their comfort with their surgeon makes a difference in their healing.
Whether it's the most minor of procedures or the most major of procedures, we treat each patient the same. And we understand that you are willing to give yourself up into our hands. And it's a very difficult thing for many people who have control of their lives, that they're going to be asleep and expect that when they wake up that everything that they knew was going to happen was going to happen. This is what we do as surgeons, and we control our room in the operating room so that the utmost respect is being done to not violate any of the private natures that the patients would be concerned about, and that we're doing exactly what they came for us to be done, and that they have consented to everything and understand that everything that we're doing is what they expect.
I chose to be here for family reasons initially, but I was pleasantly surprised with the quality of care in the area. I had trained in Detroit, and oftentimes there's an impression that if you go above a certain mile road, you're outside of the 21st century. And I was pleasantly surprised with the quality of care that was delivered here, and especially so with Covenant and with their desire to improve patient care.
I like the community type of a hospital. I like the community that we're in Saginaw. There's good people here. There's good physicians here. We offer basically the same kind of services that you would see in a larger institution. There are some specialties that we don't offer that we certainly will refer to those specialty areas, but as far as our skills go, I don't think there's anybody outside of the area that's any better at doing what we do. And it's obvious in the techniques and some of the surgeries that we offer that we may be actually ahead of the curve outside of areas outside of the Great Lakes Bay region.
There's tremendous support from not only the medical staff at Covenant Hospital, but also the administrative aspect and wing of Covenant Hospital to really provide the service for the people in the Great Lakes Bay region.
They are on the technological edge, getting us the best technology available, allowing us to do major operations with minimal invasiveness.
The staff is fantastic. They're very conscientious, and also the leadership has been very open to suggestions that we've made in order to improve patient care and the facilities and the whole system, and how if something is not working correctly, then we've been able to make suggestions that have resulted in changes, which is always encouraging.
What Covenant offers us is they offer us the ability to do the advanced technologies. They offer us the ability to offer the best medicine out there by giving us all the resources that we need to do what we do.
I think that we provide any of the advanced minimally invasive surgeries that you're going to find at a big university type program and in the big city. So I think it's a whole gamut from bariatric surgery down to just any other minimally invasive procedure that you might need.
from a convenience standpoint, if they're local to the area, it's a lot easier to travel to to Covenant rather than having to go south to Detroit or Ann Arbor. We would be honest with the patient too. If we felt that we couldn't take care of them here, we would say that we would recommend them going to a tertiary center for their care. But in most cases, we can take care of any of those problems here in Saginaw.
They're generally just a very good partner with things. They tend to listen very carefully to what we want to do and help us understand their point of view, but also try to work toward that common goal, which is quality surgical care.